Thank you, Mr. Chairman. And I want to thank you especially for convening this subcommittee to finally begin sifting through the damage that the lockdown left caused to our society by suspending the most fundamental constitutional rights we hold as Americans. There's a reason the founders created a constitution that sets limits on the powers that the government can wield. As Ronald Reagan once observed, the Constitution is not the government's document telling the people what we can and cannot do. The Constitution is the people's document telling our government those things that we will allow it to do. And the fact is, we never allowed it to close millions of businesses, lock people in their homes indefinitely, censor dissenters, forbid peaceable assemblies, shut down churches, and yet, in the jurisdictions that the left controlled, this is exactly what they did. And they were spectacularly wrong. We knew from the beginning that young people were virtually unaffected by this disease. And we knew that the elderly were at extreme risk. So what did these lockdown leftists do? They closed the schools and forced infected patients into nursing homes. We knew from the beginning that obesity was a major contributing factor to the severity of the disease. And what did these leftists do? They closed the gyms and left the liquor stores open. We knew from the beginning that outdoor transmissions were very rare and that 80% of the infections occurred in people's homes. So what did these leftists do? They closed the parks and beaches and forced people into their homes. Sweden never closed its schools, never closed its businesses, never required masks or vaccines. They trusted their citizens to make these decisions for themselves. The United States, unfortunately, imposed all of these mandates in the states controlled by the Democrats. And here's the result. The United States has suffered 3,600 deaths per million from COVID. Sweden suffered 2,600 deaths per million. So let me put it another way. If we had followed Sweden's policies and had Sweden's results, 340,000 more Americans would be alive today. And that doesn't include the millions of additional excess deaths that these policies caused from suicides, drug and alcohol-related deaths, deaths caused by delayed health screenings and deferred health treatments. It is heartbreaking and sickening to think about the butcher's bill from all of this folly. Ms. Goodwin is dead wrong. These policies didn't save lives, they cost lives, hundreds of thousands of lives. And the foolish people responsible for this carnage have yet to be held accountable. I understand why they don't want to answer for the decisions that they advocated, imposed, defended, enforced, and still defend today. But it's time we acknowledge the damage that they did and take steps to assure that they can never do it again. Our Constitution was supposed to protect us from such people, and this time it didn't. So the question I have, and I direct it to Ms. Dillon, who's been very active on this legal front, how do we prevent this from ever happening again?
Thank you for the question, Congressman McClintock. I think the biggest thing that Congress could do right now is to overrule by legislation the outdated precedent Jacobson versus Massachusetts. I hear people in this hearing praising it. At the time Jacobson versus Massachusetts was the law, black people couldn't eat at the same places as white people. People like me from Punjab weren't allowed to buy property in the United States. We've had a lot of outdated laws and dark times in our country, and that precedent is one of them. And so when I hear passionate advocates for abortion cite it as a constitutional right, it is legally premised on tiered scrutiny under the 14th Amendment, which is scrutiny developed by progressive courts to protect our constitutional rights. And that is all I'm asking for, is that that well-established tiered scrutiny be applied today in 2024 to the problems of 2024, not the problems of 150
My time is very
years ago.
limited, but I'd be very, very interested in seeing your suggestions in writing on this subject. I think the Congress, looking back on this now, can see the folly. But I want to direct the same question to Dr. Latipo real quickly. What's the most important thing we can do to prevent this from ever happening again?
Thank you for that question. as you know, I didn't go to law school. I went to medical school, and my answer would be based more in my understanding of people, my relationship with people. And I think that has to do with really helping people, really take in more of their power as human beings and their right to sovereignty and their right to control what is put into their bodies, which is an absolute right from God. And I think if more people really understood that within themselves, it would be harder for our sometimes tyrannically inclined leaders to lead them in different directions, which we saw very loudly and clearly, and to a much heartbreak during the pandemic.